Hi everyone, get ready for expert tips, practice questions, and clear explanations, all designed to make your NCLEX journey smooth and stress-free. Subscribe now and let's make NCLEX success easy together. Question 21. A nurse is caring for a client with a nasogastric (NG) tube for gastric decompression. Which action should the nurse take to verify tube placement before administering medications? A. Inject 10 milliliters of air and listen for a gurgling sound. B. Check the pH of aspirated gastric contents. C. Ask the client if they feel the tube in their throat. D. Flush the tube with 30 milliliters of sterile water. Answer B. Check the pH of aspirated gastric contents. Rationale. The most reliable bedside method for verifying NG tube placement is checking the pH of gastric contents. pH less than 5 indicates proper placement. Injecting air and auscultating is not a reliable method. Flushing should only be done after confirming placement. Question 22. A nurse is teaching a client with chronic kidney disease about dietary restrictions. Which food should the client avoid? A. Apples. B. White rice. C. Bananas. D. Chicken breast. Answer C. Bananas. Rationale. Bananas are high in potassium, which should be restricted in clients with kidney disease to prevent hyperkalemia. Apples and white rice are low in potassium, and chicken breast is a good protein source when eaten in moderation. Question 23. A nurse is preparing to administer digoxin to a client. Which finding should cause the nurse to hold the medication? A. Blood pressure of 110/70 millimeters of mercury. B. Heart rate of 50 beats per minute. C. Serum potassium level of 4.2 milliequivalents per liter. D. Respiratory rate of 18 breaths per minute. Answer B. Heart rate of 50 beats per minute. Rationale. Digoxin slows the heart rate, so it should be held if the pulse is below 60 beats per minute. Blood pressure, potassium level, and respiratory rate are within normal limits. Question 24. A nurse is providing discharge teaching to a client with a new prescription for prednisone. Which statement by the client indicates a need for further teaching? A. I will take this medication with food. B. I should not stop taking this medication suddenly. C. I should avoid crowded places and sick people. D. I can stop this medication once my symptoms improve. Answer D. I can stop this medication once my symptoms improve. Rationale. Corticosteroids like prednisone must be tapered gradually to prevent adrenal insufficiency. The other statements are correct. Taking the medication with food reduces stomach irritation, avoiding sick people reduces infection risk, and gradual tapering is essential. Question 25. A nurse is caring for a client with an arterial line. Which assessment finding requires immediate intervention? A. Dampened waveform on the monitor. B. Mean arterial pressure of 70 millimeters of mercury. C. Redness and swelling at the insertion site. D. Blood pressure of 120/80 millimeters of mercury. Answer C. Redness and swelling at the insertion site. Rationale. Redness and swelling suggest infection at the arterial line site, which requires immediate attention. A dampened waveform may indicate a clot or positioning issue, but is not an emergency. A mean arterial pressure of 70 millimeters of mercury and blood pressure of 120/80 millimeters of mercury are within normal limits. Question 26. A nurse is assessing a client with right-sided heart failure. Which clinical manifestations should the nurse expect? A. Pulmonary congestion. B. Peripheral edema. C. Frothy sputum. D. Orthopnea. Answer B. Peripheral edema. Rationale. Right-sided heart failure leads to systemic congestion, causing peripheral edema, jugular vein distension, and ascites. Pulmonary congestion, frothy sputum, and orthopnea are associated with left-sided heart failure. Question 27. A nurse is teaching a client with type 1 diabetes mellitus about insulin administration. Which statement indicates a need for further teaching? A. I will rotate injection sites to prevent lipodystrophy. B. I will inject insulin into my thigh before exercising. C. I should administer my insulin at the same time each day. D. I will store unopened insulin in the refrigerator. Answer: B. I will inject insulin into my thigh before exercising. Rationale: insulin absorption increases with exercise, which can cause hypoglycemia. The abdomen is the preferred site for more consistent absorption. The other statements reflect proper insulin administration techniques. Question 28. A nurse is preparing to administer furosemide to a client with heart failure. Which laboratory value should the nurse monitor before administration? A. Sodium B, hemoglobin, C, potassium D, white blood cell count. Answer: C. Rationale: furosemide is a loop diuretic that can cause hypokalemia. Monitoring potassium levels is crucial to prevent cardiac complications. Sodium levels may also be affected, but potassium is the priority. Question 29. A nurse is caring for a client with a chest tube. Which finding requires immediate intervention? A. Continuous bubbling in the water seal chamber. B. Gentle bubbling in the suction control chamber. C. Tidling, fluctuation, in the water seal chamber. D. Serosanguineous drainage of 50 milliliters in the past hour. Answer: A. Continuous bubbling in the water seal chamber. Rationale: continuous bubbling in the water seal chamber indicates an air leak, which requires immediate assessment and intervention. Tidling is a normal finding. Bubbling in the suction control chamber is expected. Question 30. A client receiving total parenteral nutrition, TPN, suddenly develops diaphoresis, shakiness, and confusion. What is the nurse's priority action? A. Check the client's blood glucose level. B. Slow the TPN infusion rate. C. Notify the healthcare provider. D. Administer IV fluids. Answer: A. Check the client's blood glucose level. Rationale: clients receiving TPN are at risk for hypoglycemia if the infusion is interrupted or reduced. Checking blood glucose is the priority action to determine if hypoglycemia is causing the symptoms. Let's know how many questions you answered correctly by dropping it in the comment section below. Please subscribe, like, and share. We love you.